Laparoscopic surgeries, limitations and risks involved. See, if laparoscopic surgery is performed by the best hands who is trained for some time and been operating for some years, I don't think there is any major limitation or major risk which is involved, unless there are risks related to the patient. But commonly we see some amount of risk when the surgeon is in the learning period. So this will happen even in open surgical procedure. But at the same time, if the patient himself or herself is a risky patient, I mean to say that the patient is a badly managed diabetic, high blood pressure patient, or a patient with heart-related problems or lung-related problems or major abdominal-related issues are high-risk patients. And at the same time, they carry on the risk to the operating procedure as well. Limitations I mean to tell are, say for example, in an abdominal procedure, if the laparoscopic surgical procedure had to be performed on a patient who has undergone multiple abdominal open surgeries, for whatever reason, it becomes a limitation where the difficulty adds on and the surgery is not very ideal. A patient who is with advanced abdominal cancer is a limitation again, because the surgical procedure doesn't go well. Patient who is a cardiac patient who is a little compromised on the heart, and a patient who has lung-related compromised situations are not very ideal patients to undergo laparoscopic surgeries. Here we try to filter patients and tell them, okay, who is ideal for laparoscopic surgery and who is not. Very few people are filtered out of the laparoscopic equation. Most of them are fit enough to undergo laparoscopic surgical procedures. Risk, I mean to say, is some patients may develop surgical related complications just because of poor efficacy of the surgical techniques or surgical instrumentations which are not good enough. So for example, the camera is not of high quality, the vision becomes a little compromised, and which will induce some difficulty or trauma to unwanted situations which warrants complicated related conditions. Or else I don't see major setbacks and risks or limitations related to laparoscopic surgery when compared to open surgery.